implementing your setups. Just my name is Dr. Israel Soko. I'm acting director of such processes. Because I'm not the one who supposed to much, just for the few words, I'd like to welcome Dr. Chuga. Then we can just continue as the time goes on.
Asante. Nashukuru kwa kufika hapa na nitazungumza Kiingereza. So kuna wengine ambao hawafahamu Kiswahili. So nitaongea Kiingereza.
Maybe can you introduce the members of this?
Before we start having some work, we're going to introduce first the people that are here, the guest of honor. The guest of honor, the executive director of Benjamin Mkapa, Professor Abel Makubi. Now an internship here, and I do have Bonaventure Mtega is working with Bonaventure Mtega is working with Aga Khan University, and we do have Sister Margaret is a cardiac intensive care nurse from the KCI. So these are part of the trainer, and along with this we do have among the teaching staff, we do have Daniel, who is a staff from here, who also received training on critical care nursing. We do have Lugano, who's also received critical care training on the subject that we have here. And we do have other Emergency Medical Services Academy staff, who are photographers and logistical staff. Apart from this, the executive director, we do have staff from Benjamin Mkapa, from ICU, emergency department, surgical, and other departments that have joined for this training. And we do have staff also coming from Singida. Please, you can raise your hand from Singida, okay, who came to this training. We do have staff from Uhuru Hospital, okay, who joined for this training. We do have staff from Consolata Hospital. We do have staff from private sector, from Tindwa Medical Services. We do have other staff coming to this training as emergency, general ward, ICU. They all came in either for basic nurses or basic doctors. After I've mentioned all of you, now I will go into speaking a word upon your permission, Executive Director, a word of welcome in this spot. Dear guests of honor, I greet all of you in the name of United Republic of Tanzania. Dear guests of honor, on behalf of EMSA, please accept our condolences for our beloved brother and mentor, Dr. George Dirunga. You all remember that our mentor, the head of department of emergency department, Dr. George Dirunga, was key of emergency services in the region and was actually mentored most of us, passed away a few months ago. Dr. Dirunga was a pioneer of emergency medicine in Dodoma, and he's part of many success stories of emergency care in Dodoma. Dr. Dirunga's loss touches the heart of anyone who loves patient care, and hence the loss belongs to each one of us. It is of great honor and appreciation that to welcome all of you in this workshop. Emergency critical care services in Tanzania are rapidly growing. We have seen many investment and a huge investment coming from the government in the area. All this emphasize the urgent need to enhance capacity of skilled health professionals to support the increasing number of newly established intensive care units, emergency department, and high dependency use across the country. This development aligns with the government effort to improve access to high-quality critical care services, reducing maternal mortality and overall mortality caused by critical illnesses. Bridging intensive care expertise is highlighted in a recent study I just quoted, the African critical illness outcome. We all realize that 12.5% of hospital inpatients are critically ill, and 69% of them being treated in general wards. 50% critical ill patients do not actually receive essential emergency and critical care services, out of which 21% of critical ill patients die within only 7 days, and as compared to 2.7 who are non-critical ill who die within 7 days. These findings, to we as medical staff, are alarming and underscore the urgent need to enhance our capacity in life-saving in emergency care and healthcare, irrespective of our specialties, because not all specialties are working in general wards. Not only ICU is where we have got critical ill patients, we also have critical ill patients in other general wards. And there's a special concern in our country where we do have almost 90% of healthcare staff are working, of which over 80% of these staff are working in the healthcare, primary healthcare. Actually, 80% of these facilities are in the primary healthcare level, and 80% of all these staff are actually non-specialists. So you can see critical illness being managed by non-specialist physicians. Currently, there is a significant shortage of intensive care specialists at the primary healthcare level, particularly in municipal and district hospital. It is crucial for medical doctors working in ICU to be well trained, assessing critical patients, initiating timely treatment, and providing organ support. What's EMSA's role? EMSA's vision is to complement the government efforts and other stakeholders in improving healthcare services in the primary healthcare level. Our initiative focuses on knowledge transfer, with the international specialists collaborating to train Tanzanian specialists who in turn empower healthcare workers. And Executive Director, you have seen many of these specialists were trained last year and this year to become instructors, and are now a majority of them are training this class. EMSA has a state-of-the-art simulation labs with kits enough to train more than 200 healthcare staff in more than several primary emergency and critical care workshops. What are we looking at? We are looking at a continued collaboration and expansion. This year workshop continued collaborative effort initiated in 2024 with Australian expert led by Professor John Botha. That initiative successfully trained over 190 doctors and nurses in Dar es Salaam, Arusha and Zanzibar. He was here this year along with Professor Ross Freeburn, the author of the basic course we gave you last year, Professor, when we came here. In this support, Dr. Patel and Dr. Hellings actually were here last year when we had the first batch of our trainers. They also came this second time. The last was 2024, and they will be here for the last 3 days for the bedside coaching alongside BMH staff. In 2025, Professor, our goal is to expand this training to district hospitals, focusing at ICU and emergency department in the remote and underserved region, especially focusing at Mtwara, Kigoma, Songwe, Mbeya, Pemba, Tanga, Manyara, Songea, Mwanza, to reach more than healthcare staff. While we had 2 symposiums last year in Dar es Salaam and Zanzibar, there will be only one this year in October. This is going to be in Mbeya. That will host more than 200 healthcare staff from Highland Zone. We are thinking of Benjamin Mkapa Hospital as a training center for critical care. Given Benjamin Mkapa's role as a pioneer of advancing cardiovascular critical care, EMSA envisions Benjamin Mkapa Hospital as a key training center in the Central Zone for emergency and critical care education in Tanzania. This partnership will play a crucial role in building capacity and strengthening ICU services across the country. We would like to send our gratitude and for official opening. The guests of honor, we deeply appreciate your presence and allowing this event at Benjamin Mkapa. Your continued support for initiative underscores the importance of emergency critical care training in transforming universal health care in Tanzania. I extend my sincere gratitude to the international volunteer experts and all participants for their dedication to this cause. On behalf of EMSA, I would like to thank you for officiating this event.
Asante sana Dr. Chunga, but because today it's not my part to talk much, but just for a short time, as I stated before, for those who just coming for this training, please, when you leave here, make sure that you are going to implement all the things which you have been learned here for others. Because if you stay with the knowledge and the skills which you acquire here, and you didn't just teach your friends, just make an assumption. Make an assumption, you just fall down and you are the only one on that hospital which you have that knowledge of manage emergencies. Who will support your health? Who will give you resuscitation? But if you just going and implement to others, so all friends which you just give the knowledge and the skills which you acquire here, it means they will help you. So make sure that when you leave here, you are going to disseminate the skills and the knowledge which you acquire from this training. I'll take this opportunity to welcome Professor Makubi, the Executive Director of our hospital, just to have a word for opening of this training. Karibu mkurugenzi.
Thank you, Dr. Osoko, our Director, Acting Director of Surgical Services, Dr. Ramadan Chunga, the Director of EMSA, Dr. Winnie, the Acting Assistant Director of the Emergency Service within Benjamin Mkapa Hospital, facilitators from South Africa and Australia, local facilitators for this training, participants, good morning. Yes, my great honor to welcome you all to this critical care educational workshop on the basic assessment and the support in intensive care course for doctors and nurses. This pioneering initiative marks a significant step towards strengthening. I think this is enough. You can just leave that. Just put it here. Marks a significant steps towards strengthening the emergency and the critical care service in Tanzania. And I would like to take this opportunity to thank the organizers for this workshop, EMSA, and all our facilitators for being able to come to this meeting. Thank you very much.
Thank you.
I have been informed that this basic course was originally founded by the Chinese University of Hong Kong, and it was endorsed by the European Society of Intensive Care Medicine as an advanced clinical training program in intensive care. This foundation course provided essential knowledge in critical care, resuscitation, organ support, and mechanical ventilation, as well as equipping junior doctors and ICU nurses with skills they need to manage critically ill patients. This training will specifically address the staff who are entering the ICU for the first time, as well as junior staff who will be assigned to the ICU. But not only to the ICU unit, but also to the other intensive care units like a high dependent unit and also coronary unit. Additionally, this workshop will serve to consolidate and enhance the knowledge of our senior staff already working in the ICU and the other high dependency unit, and it will offer a comprehensive approach that will ensure that all levels of experience are equipped with the necessary skills and expertise to provide optimal care in a critical care setting. I've been informed that this workshop will also offer hands-on expertise on life-saving skills, such as I've said, resuscitation, stabilization of patients, organ support, and the safe handover and the transport of critically ill patients. We're seeing some of the patients who are coming here, sometimes they are not properly transported from the lower health facilities to Benjamin Mkapa. So we understand that we needed to equip some of our staffs with knowledge and skills on how they can provide the support during transport. And here I have been informed that there are staff from the lower health facilities and who have been referring patients from their facilities to Benjamin Mkapa. So this course, I think, will give you a more understanding and a more skills on how you should be able to prepare your patient and the transport to Benjamin Mkapa or other referral hospitals. Without much support during the transport, we lose a lot of patients on their way. So I think that's one of the most important critical steps which we need to provide much emphasis and support so that all our patients who are coming from the lowest facilities are taken care in a way that they are able to reach the referral hospital being in good condition. So with this course, I think you will be able to get all those skills, but also you will cover other aspects of critical care management, like mechanical ventilation, initiation and also maintenance, ensuring that to those in urgent need. Through this training, we are not just building your knowledge, but empowering you to make a difference in the lives of patients who require urgent and specialized attention. I've also been informed that more than 120 ICU have been built across our country. However, most of these ICU units do not have enough staff. And those who are there, the few ones who are there, are not well equipped with the management skills of critical ill patients. So there is a need of capacity building among health professionals who have never been exposed to such skills, but also for those who are juniors. This is a better opportunity for them to be able to take care of seriously ill patients. I've also been informed that this course is fairly cheap in terms of cost compared to other areas or other countries. So it is my understanding that you will use this opportunity to use the available space for this workshop and the coming workshops to have more staff who can come and get this kind of exposure. Changes on how we can train our staff when it comes to the critical care management. But now we are lucky that we have the facilitators from Australia, we have facilitators who have been trained locally here. So it's up to the institutions and the hospitals now to decide how we can utilize these opportunities for available facilitators, locally and internationally. The reason why a hospital now should not have 2 or 3 staff who are trained in critical care management. So we have been brought our colleagues from EMSA to support ongoing efforts of our government to build the capacity among healthcare profession, especially in the area of critical care management. Thank you very much for your support. This course is a continuation of the efforts initiated in 2024 with the Australian volunteer experts. Since last year, trained as trainers of train. As a result, more than 180 doctors and nurses were trained in Dar es Salaam, Arusha, and Zanzibar. And I'm pleased this year, 2025, this course has come to Benjamin Mkapa and Dodoma, and there are plans to go to Zanzibar and other regions like Mbeya and Mtwara, expanding its reach and impact across the country. Additionally, EMSA has informed me that Benjamin Mkapa, which is now one of the zonal training center for emergency training, has 3 nurse instructors, 2 physician instructors, and these people will serve as key drivers of this course within the central zone, covering the areas of Dodoma regions, Singida, Manyara, also Tabora, Morogoro, and possibly staff from Jombe. So I would like to ask my colleagues who have been trained as trainers to share their knowledge with the other colleagues. Don't become selfish. So be available to disseminate your knowledge to other colleagues. So whenever we need your support, please be available so that you can disseminate the knowledge that you gained last year from these experts and be able to transfer it to the other colleagues within the hospital and outside the hospital. So this initiative would not only be possible without the dedication and expertise of both local and international faculty, as I have said. And I would like to extend my heartfelt gratitude to the international faculty. Dr. Patel, is it Duffy or Duff? Okay, thank you very much also. So let us clap hands for these colleagues for traveling all the way from Nigeria and coming here to support the capacity building of our staff. But also we have local experts. We have Dr. Lugano Wilson, is he available? Thank you also. Dr. Zainab from Lumumba Hospital, thank you very much. Dr. Ramadhani Chunga, yourself, thank you, and you are doing a good job with EMSA. Congratulations.
Thank you so much.
Dr. Rebecca, this is from Bugando, is it?
Yes.
Dr. Rebecca?
It's not here.
Okay, I know her. She has not been able to come, is it?
Yeah.
Okay. Dr. Abel Dago, okay, from Mount Meru. Dr. Makere. So this is another team of local experts, which is now part of the national trainers. We have the nursing experts. Dr. from JKCI, Daniel Patrick from Buganda, Joshua Duma. Okay. Benjamin Mkapa, we have also Amina Nasoro. We also have Monica Mnis from Songwe. Bonaventura Mtega from Aga Khan Hospital. So your dedication to critical care education is inspiring, and I'm confident that through this training you will promote critical care education across the country, helping us to achieve our vision of providing high quality, life-saving health care. So I also would like to acknowledge our department within Benjamin Mkapa for being supportive on this program, especially the emergency medicine department led by Dr. Winnie, but also the emergency and intensive care unit led by Dr. Lugano and his colleague, and the nursing department. Thank you very much for your support. So my understanding is that after this course, most of you will be able to go and apply the knowledge that you have gained, that you will gain, and you will be able to disseminate the knowledge to the other colleagues within your hospitals. We have been facing a lot of challenges when it comes to management of critical care patients. I have been doing some field rounds within the wards, and sometimes I get worried on how we are managing our patients, especially the sick ones. To me, when I find a patient who is severely sick, having respiratory complications like aspiration pneumonia, like bed sores, like hypostatic pneumonia, like sepsis. Sometimes I get a lot of troubles. Why we should not be able to prevent these complications? Within our local families, it's very rare to find a stroke patients developing bed sores within our local families. But this is happening in hospitals, and we are trained to care these patients. So why should we allow such complications to happen within our hands? Despite the fact that you are well trained to care very sick patients. So I've been getting a lot of troubles about this poor nursing care to critical illness. Because in a hospital, we don't expect such complications to happen unnecessarily. We have poor nursing care to critical ill patients. So, it is my understanding that when you go back to your hospital, we should not be able to hear such complications coming from your intensive care, also from your high dependent units or your wards. The other thing that is worrying us is about the way we are managing stroke patients. This is a major challenge. We are losing a lot of young who are coming with stroke or ischemic stroke. Hemorrhagic stroke may be high, even for ischemic stroke. But we should be able to use every means to prevent other complications related to stroke. But this has been really discouraged in Tanzania. So I think we should change the way on how we are taking care of critical ill patients, including those patients with stroke. To die soon. Even if you are totally conscious, we are trained to delay death. That's why we are called doctors and nurses, to delay death. So if you can delay death even for 5 days or a week, that is very thankful to us because to do. To leave our patient die within our hands, we should use whatever means to have in terms of skills and knowledge to delay death and avoid. And there was in the zone of hospitals because the mortality has been so high. And here I would like to ask my facilitators to put more emphasis on that area. Within the bench Kappa, we normally receive 3 to 4 patients of stroke every week, and most of them are young patients. But the mortality has been quite high. So the problems normally arise from where the patients come from until when we receive them and the way we take care of them while they're within the hospital. So stroke is a major problem for us now, and we should be able to address this in the way we care our patients. And to go through the emergency medicine, we understand that we stabilize these patients properly at the EMD department, the likelihood of death becomes much lower. If they are not well stabilized at the EMD and ICU, their chances of dying is very high. So we should put our efforts more on how we stabilize and nurse these patients while we are taking care of them. For pregnant mothers, again, the other challenge is eclampsia. Those who come with eclampsia, they almost die because of negligence or poor skills. First of all, they are referred very late from the lower health facilities with a lot of complication. And when they come here again, there is improper management on how we take care of them. So this workshop should be able to open up our eyes and change our manner on the way we are managing these patients. Having a critically ill patient does not mean that he should die tomorrow or the other day. We should be able to delay or prevent death at that particular point by using whatever means we have. So we'll be comfortable if after this pause I will see some positive impact among my staff on the way they are caring critically ill patients. And here I have facilitators. I've been talking to Dr. Lugano several times, the nurses in the ICU, to Dr. Win. Some of the deaths that are happening here are preventable. But we are losing some of them because of either negligence, but also because of lack of knowledge. And also some people are not ready to change their attitude and their practice, although they know what they are supposed to do. We have been offering all these courses to many other staff, but when you find them the way they are caring patients, you wonder why they are doing such things. So the attitude has to change, even if you are getting these courses. Just come here and learn this theory and the practice. If you don't change your mindset, it won't help us. What is coming out from this session? And go and practice it. Not only theoretical, but also practical. So you should be the pioneers of this change in critical care management. Not only theoretical, but practical. And your performance will be measured based on the way you rescue patients from dying. Critical ill patients who are likely to die. If you can rescue them from dying, is how you can measure your capability and your competence. So some of my colleagues say that we are losing this patient because they came here because they are very sick. They came at terminal stages. Yes, this is a referral hospital. You should expect to get terminal ill, very sick patients. You should not expect to get simple cases here. So we are here to manage complicated and difficult cases. So if you say that people are dying because you are getting very severely sick patients, critical illness, that's not true. That's why here we are harboring a lot of specialists to be able to take care of these complicated and critical ill patients. So that should not be an excuse for you to allow patients dying because they came in terminal illness or in a critically ill condition. It's your job, it's your responsibility to rescue them from dying or to delay death at that particular point. So Benjamin Mkapa is now on the way to become a national hospital. Probably going to be a second national hospital apart from Mbalimbali Hospital. So we need to support Benjamin Mkapa to improve the quality of service, especially for these complicated patients. Those are the patients who are going to be measured in terms of performance. Not the simple ones, malaria, UTI, simple hypertension. So I hope our colleagues from Australia, from other institutions will come again in the near future to be able to provide more capacity to my staff with the aim of improving the quality of care within Benjamin Mkapa, also within the other nearby hospitals in the central zone. So with those remarks, I once again take this opportunity to thank all participants for coming to this workshop from Dodoma, from Singida, Songwe, Iringa, Morogoro, and other regions. I also applaud all the participants for your commitment to learning and for your dedication to improving the health care in the country. With that, I officially declare that this critical care education workshop for nurses and the doctors is open at Benjamin Mkapa Hospital. Thank you very much.
Nashukuru mkurugenzi kwa neno la ufunguzi. Just thank your executive director for the word of opening. And I think according to time, maybe you can just give a room now to continue training, and then maybe we shall meet each other on the corridors. And in case of anything, you can just contact us, and then we can just solve it. Karibuni sana.
The Same Qualities Foundation kwa kushirikiana na hospitali ya Lumumba Zanzibar wanakuletea upasuaji wa midomo wazi utakaofanyika bure kabisa. Ni kuanzia tarehe 7 hadi 11 Aprili. Mahali ni hospitali ya mkoa ya Lumumba Zanzibar. Mzazi unaomba kumfikisha mwanao hospitalini hapo siku moja kabla ya kuanza kwa zoezi la upasuaji. Kwa mawasiliano zaidi tupigie simu nambari 0776 177 742 au 0738 229 449 na 0717 531 312. The Same Qualities Foundation, hatua moja, tabasamu moja. The Same Qualities Foundation kwa kushirikiana na hospitali ya Lumumba Zanzibar wanakuletea upasuaji wa midomo wazi utakaofanyika bure kabisa. Ni kuanzia tarehe 7 hadi 11 Aprili. Mahali ni hospitali ya mkoa ya Lumumba Zanzibar. Mzazi unaomba kumfikisha mwanao hospitalini hapo siku moja kabla ya kuanza kwa zoezi la upasuaji. Kwa mawasiliano zaidi tupigie simu nambari 0776 177 742 au 0738 229 449 na 0717 531 312. The Same Qualities Foundation, hatua moja, tabasamu moja. The Same Qualities Foundation kwa kushirikiana na hospitali ya Lumumba Zanzibar wanakuletea upasuaji wa midomo wazi utakaofanyika bure kabisa. Ni kuanzia tarehe 7 hadi 11 Aprili. Mahali ni hospitali ya mkoa ya Lumumba Zanzibar. Mzazi unaomba kumfikisha mwanao hospitalini hapo siku moja kabla ya kuanza kwa zoezi la upasuaji. Kwa mawasiliano zaidi tupigie simu nambari 0776 177 742 au 0738 229 449 na 0717 531 312. The Same Qualities Foundation, hatua moja, tabasamu moja. The Same Qualities Foundation kwa kushirikiana na hospitali ya Lumumba Zanzibar wanakuletea upasuaji wa midomo wazi utakaofanyika bure kabisa. Ni kuanzia tarehe 7 hadi 11 Aprili. Mahali ni hospitali ya mkoa ya Lumumba Zanzibar. Mzazi unaomba kumfikisha mwanao hospitalini hapo siku moja kabla ya kuanza kwa zoezi la upasuaji. Kwa mawasiliano zaidi tupigie simu nambari 0776 177 742 au 0738 229 449 na 0717 531 312. The Same Qualities Foundation, hatua moja, tabasamu moja.
Mtazamaji wa SQF TV, siku ya leo tupo katika ukumbi hapa ndani ya hospitali ya Benjamin Mkapa Dodoma, ambapo ni mfunguzi wa mafunzo ya huduma ya dharura ambayo inadhaminiwa na taasisi ya EMSA. Karibu, lakini pia tutaendelea kukurusha matangazo mbalimbali ambayo yataendelea kurushwa live kupitia YouTube yetu ya channel SQF TV. Uko na Mipendo Gotoni, lakini nyuma ya kamera fundi mitambo yupo Pantaleo Lugwisha.
The Same Qualities Foundation kwa kushirikiana na hospitali ya Lumumba Zanzibar wanakuletea upasuaji wa midomo wazi utakaofanyika bure kabisa. Ni kuanzia tarehe 7 hadi 11 Aprili. Mahali ni hospitali ya mkoa ya Lumumba Zanzibar. Mzazi unaomba kumfikisha mwanao hospitalini hapo siku moja kabla ya kuanza kwa zoezi la upasuaji. Kwa mawasiliano zaidi tupigie simu nambari 0776 177 742 au 0738 229 449 na 0717 531 312. The Same Qualities Foundation, hatua moja, tabasamu moja.